everyone. Thank you so much for being here tonight. I am so excited to invite you or to welcome you to the Region 9 Perinatal Quality Collaborative's panel discussion. We'll be focusing tonight on the COVID-19 vaccine and its impact on the pregnant and breastfeeding populations. So before we get started, I will quickly introduce myself and my team. So my name is Helen Joa, and I'm the project manager for Region 9. And on the call tonight, I'm also joined by the rest of the Region 9 leadership team, including Lisa Kane Lowe and Camila Davis Wilson, who are the Region 9 co-chairs, and Julie Tamburello, who's the fiduciary lead. While folks are still logging on, I'm going to go ahead and just offer a brief introduction about who we are and the work that we do. There's many new faces we saw in the registration, and so we just want to welcome everyone into the space and make sure you know who we are too. And then once I do that introduction, I'll go ahead and introduce each of our panelists, and then we'll dive into the Q&A portion of tonight's event. So there are 47 states that have perinatal quality collaboratives, and these are state or multi-state networks made up of multidisciplinary teams that aim to improve perinatal health outcomes. And they do this by utilizing evidence-based technology and quality improvement methodology. And so all of these 47 states make up this national network. However, the state of Michigan is a little bit different. So as you can see on the map, we have 10 different prosperity regions and 9 regional perinatal quality collaboratives making up each, comprising each of those 10 regions. And so we're divided up because we know that the issues that we see here in the maternal and infant population here in Southeast Michigan looks very different than what's happening in the UP versus in Detroit. And so the idea is by having this regional focus, we'll be able to develop specific projects that meet the needs of our communities and ensure implementation of the Mother-Infant Health and Equity Improvement Plan at the local level. And so we do this and we ensure that the plan is being implemented at the local level by really engaging with a diverse range of broad stakeholders. And together we develop data-driven strategies and utilize evidence-based practices and quality improvement methodology to improve health outcomes. And so here we are in Region 9 tonight in Southeast Michigan. And so we're made up of Livingston, Jackson, Washtenaw, Hillsdale, Lenawee, and Monroe counties. And this model is specific to the work that we do here as Region 9. And so as you can see from the diagram, we aim to use health equity as the foundation to every project and every initiative that we pursue. And really what we're trying to do is address maternal and infant morbidity and mortality by building systems of care that really center the birthing person and their family. And so we have programming that addresses trauma-informed care, as well as the development of mom-centric models of care and home visiting programs. And so each of these topic areas has its own work group, and we work really hard to make sure that our community has the resources they need. And so I would really encourage you to check out these resources. They're all available for free on the Region 9 website. For pregnant folks, we have resources that explore the different pregnancy care options available to you and how to access those resources locally. And then for the providers on the call, we also have a ton of resources about how to implement a trauma-informed approach to care, find other supports or educational tools that might be helpful for you in your practice, along with many more materials. And so I really encourage you to check out region9.org to view those materials and also check us out on social media. We have both a Facebook and Instagram account at Region 9MI. And so if you ever have any questions about Region 9, please feel free to reach out to me. I'm happy to answer them. And you can also check out our website. It's a really great resource. And so this year, we are really excited to receive additional funding to support COVID-19 immunization efforts across the region, really focusing in on the maternal and infant populations, as well as populations that are disproportionately affected by COVID-19. And so tonight's panel discussion is really in thanks to this additional funding as we aim to support these efforts across the region. And then I'm also really excited to share with you all another product of these efforts. And so we, over the last couple of months, went around and we asked community members here in Region 9 what motivated them to get the COVID-19 vaccine. And so we heard from many women who were either pregnant or breastfeeding when they were vaccinated. And we would love to just take a minute and share those stories with you all tonight. So give me one moment while I switch my screens and I'll play this video for you.
I'm a healthcare worker. I saw the devastation that the disease can cause. And still, when it was my turn to do it, I kind of, even a little part of me had a pause, just like, is this the right thing? Do we know enough?
The biggest concern was that it was new. I am a new parent, my husband is a new parent, and so even the regular standard vaccines we were reading on.
And it was sort of a trust in the history of the vaccine technology, to know that, yeah, this is a vaccine to a new virus, but this vaccine technology itself is not new.
The selling point for me was that my daughter was going to receive some antibodies.
Antibodies were passed through the breast milk to the babies, and I was just thinking about, I want to do anything I can to protect him.
What's the one thing you can do as a new mom is for immune protection of everything, right? Cold, flu, anything, is breastfeed your baby.
Even though I got vaccinated while I was pregnant, it was in the second trimester of pregnancy. We don't know how much of the immunity my daughter got by the time she was born. And then also, if my immunity was waning, certainly the antibodies in the breast milk would be as well. So the booster was really important to me to protect myself and my family.
We know a lot now. We have a lot of good evidence to say that the vaccine is safe during pregnancy, and we could have spared them this infection during pregnancy. And so I always tell patients, you're weighing the risks they're talking about of the vaccine, not against no risk. That's not the equation. It's not vaccine risks or no risks. It's vaccine risks or risk of infection.
I know that being pregnant is scary in itself, and it's loaded with lots of worries of just trying to make sure you protect your baby, while they're still in womb and then when they're born. People can say that vaccinated people and unvaccinated people both can catch and carry COVID, which is true, but the chances of somebody getting COVID that's unvaccinated is just so much higher. And so with that, we decided that vaccinated family and friends are the safer bet for him. But not having been able to see our unvaccinated family members, it's taken a toll mentally on our whole family.
It's good to be able to mix and mingle with our family and friends who are vaccinated and kind of have that line of support, especially as new parents.
Who else were you trying to protect when you got the vaccine?
My sister.
Where's your sister? A baby, yeah.
The guilt has been lifted knowing that I am doing everything I can to be safe, and that makes me feel good.
And so I'm not going to say that a lot has changed, but the biggest thing for me was family and support and being able to have a birthday party for my daughter who just turned 1.
For me, it's just the added layer of safety and protection, less risk for hospitalization and death. I mean, that's the goal. I want to be alive to raise this kid, to raise a new baby, and I want him to be safe. Once it's safer, traveling probably, and getting back to life as normal.
I got vaccinated for my daughters.
I got vaccinated for my daughter, Eleanor.
I got vaccinated for my son.
I got vaccinated for my daughter.
All right, I hope you all enjoyed that. I have seen it so many times down. Each time I watch it, a different part stands out. And so I really just want to give a huge thank you to Holly Tamburello, who created and produced this video. And then just a huge thank you to all of the community members who are willing to share their stories. This video is available on our website, so please feel free to share it as you see fit. We find that really hearing people's stories is something that's so encouraging and motivating for folks to get vaccinated. And we understand that there are concerns when you are pregnant or breastfeeding. And so we hope that these individuals and hearing their stories help to give you a new perspective on what it's like to make that decision, and maybe help you make the decision that's best for you and your family. All right. And so I am very excited now to introduce our lovely 4 panelists. So I will go ahead and read each of the bios for each of the panelists, and then after that, we'll go one by one and have them introduce themselves more personally. As I'm introducing folks, please feel free to put any questions that you might have for them in the chat. Any questions that you submitted with your registration is in my big question list for everyone, and we're going to go through, and with the help of my team out there, making sure that we answer as many of your questions as we can tonight. All right. And so first up, I would like to introduce Amanda Marsh. She's the Senior Breastfeeding Peer Counselor for the Jackson County WIC Department and is also a certified lactation specialist. She believes in using an engaged, community-based approach to supporting breastfeeding individuals. Welcome, Amanda. Next up, I would like to introduce Dr. Bryan Popp. He's an obstetrician gynecologist in Ypsilanti, Michigan, and has practiced general OB-GYN for well over 20 years. He's the department chair for the Obstetrics and Gynecology Department at St. Joseph Mercy Health System, and he's known for his team collaboration, inclusivity, and professional integrity. Welcome, and thanks for joining us tonight, Dr. Popp. Then next, I would like to introduce Kris Dewey, who is the health educator for the Hillsdale Health Department. She's a resident of Hillsdale, Michigan, and is passionate about developing and promoting health programs for her community. Kris has been engaged with COVID-19 outreach work since May of 2021. Thanks for being here tonight, Kris. And then last, but certainly not least, we have Najma Treadwell. She is a trusted parent advisor and community leader here in Washtenaw County. She is a mom of 6 and passionate about uplifting and supporting mothers and families in her community. She's passionate about sharing information she receives and allowing families to make their own informed decisions. She's been working with families nonstop since the onset of the pandemic to make sure daily needs are provided. Thanks so much for being here tonight, Najma. All right, so please join me in welcoming our lovely panelists. As I mentioned, I am going to turn over the mic to each one of them to let them introduce themselves a little bit more, share why they're here tonight, and the biggest impact that they have seen from the COVID-19 pandemic. And so if it's okay with my panelists, we'll go ahead in the order that I introduced you all, which is just random, but hopefully that'll help us move things along. So we'll start with Amanda and then move over to Dr. Popp and then Kris and then Najma. So Amanda, the mic is yours.
Hi there. So yes, I'm Amanda Marsh, and I am one of the senior breastfeeding peers at the WIC office in Jackson. I have 3 boys, and I'm very busy just chasing them around right now. They are still pretty little, so lots of fun. Yeah, COVID has definitely impacted the work that I do. Certainly my personal life, but definitely the work that I do. I've seen a lot of moms. I've actually seen a lot of moms initiate breastfeeding where maybe they wouldn't before, because they are aware of the, good things that breast milk gives their baby and the immunity that they can gain from that. So that's been a positive outcome of COVID.
Good evening, everyone. My name is Bryan Popp. It's a pleasure to be here. I have been a community physician for about 20 years. I also am currently the department chair for OBGYN at St. Joe's in Ann Arbor. I have 4 kids, and I have lived through this COVID vaccine, for them being at all stages, to going away to college, to being in elementary school. So each stage we've had different journeys along the way. I'm excited to be here tonight to have some conversations about the scientific evidence about COVID vaccines, and to have a group conversation about how we can continue to work as a team in a community to help some of the vaccine hesitancy that continues to exist today. How COVID has affected me, from a professional basis, I would say that it's been amazing to see the resiliency of teams and the resiliency of patients that have had to happen over this COVID pandemic, and all the changes that have happened to the regulations, and what we tell patients and how we change the rules from day to day. So that has been very fascinating to see that. But I also would say that it's been devastating to have to watch some of the consequences of COVID, especially in our OB population. Telling families that they can't have all of their loved ones in the delivery room at the time of delivery because of a COVID positive result. Things like that are just really challenging to be a part of, and to have to walk that journey with the patient. So really look forward to participating in this conversation tonight.
Hi, I'm Kris Dewey, coming to you from rural Hillsdale County. So if I lose internet connection, please excuse me. I'll get back as fast as I can. I am really pleased to be asked to be part of this panel this evening. I am a mom of, 6 between my husband and I, and we have 17 grandchildren, and we enjoy life fully with the kids. I think the biggest challenge, professionally, the biggest challenge with COVID is, as Dr. Popp mentioned, that the rules seem to change every day. Trying to keep the population informed about how to best take care of themselves. Personally, there's been a lot of personal impact as far as folks in my close circle that have had COVID, have died of COVID. I was in long-term care during the pandemic as well as an administrator, and having to have families separated from their loved ones in the early stages for almost a year. It was just heartbreaking. And so my hope as part of the health education team is to just bring the facts about COVID and the facts about the vaccine. And everyone has their own personal choice, but I'd like people to make a decision based on what the science says, not what social media tells them.
Hello, everybody. I am Najma Treadwell. First and foremost, I just want to say thank you for allowing me to be a part of this panel tonight, to be able to bring a different perspective to COVID and COVID vaccine. Normally, it's kind of one-sided when I see a discussion like this, so I'm very thankful. The question is, the biggest impact I've seen with COVID so far is 2, and it's on both ends. It's just that I've now seen people who felt stagnant in positions and jobs and school now feel more open to try new things. And I think that prior to the world shutting down and things like that, that may have never happened for them to finally step out and to start doing things that they have placed on the back burner for themselves. And then on the other end has been division, so much division in people's homes, in their families, and that's the real sad impact from COVID that I've seen. It's just so much division. So there you go. Oh, and I guess who am I? I'm a mom of 6. Also, I'm my children's primary educator. They range from ages 2 up to 17. And I enjoy each and every moment of it because it seems to be going by super fast. So yeah.
Great, fabulous. Well, thank each of you so much for being here tonight. I am really just so excited, and already am learning more about each of you. So I'm very excited to keep learning more from you. So like I mentioned to all of our attendees, please feel free to put any questions you have in the Q&A. And actually, to really set the stage for tonight's conversation, I'm going to turn the mic over to Dr. Popp, who's going to give us a really brief overview about how COVID-19 specifically impacts pregnant individuals, the development of the vaccine and its safety and availability for pregnant and breastfeeding populations, and any current recommendations. So Dr. Popp, the mic is yours.
Yeah, absolutely. Thank you. A brief overview of COVID is a challenging thing to do for sure, but I'm going to do my best to do that. So, I started this off about where were we a couple years ago? And we were sitting in groups like this a couple years ago, and we just weren't sure, right? There were so many unknowns about what COVID had to offer and how it was going to affect specifically the pregnant patient population. And so we were really left to use the science that we had, historical science, and we were left to hypothesize about what we thought would happen. And so I think at that point, a lot of us made the hypothesis that we felt like the vaccine most likely would be safe for our pregnant population, but we surely didn't have the data to show that. And I'm happy to be sitting here now feeling like that we do have the data now, and we can support that this is a acceptable and recommended vaccine and a safe vaccine. The other hypothesis that we made at the time is that we felt that most likely COVID-19 would not be good for a pregnant patient. And so we used our information that we knew kind of about the flu vaccine, about the flu in general, and patients that had the flu and they could get really sick in pregnancy. And we thought that COVID-19 would probably follow a similar course. And unfortunately, that did come true. So COVID-19 is a challenging virus to get when you're pregnant. We know that there's a 3 times increased risk of a patient going to the ICU if they get COVID-19 in pregnancy. We know there's a 1.7 time increased risk of maternal death if COVID-19 in pregnancy, and a 2.8% increased risk of preterm preeclampsia. And there's many other things that are coming out in our literature that have shown us that exactly what we thought was going to happen, which was COVID-19 was going to be more challenging pregnancy, has been true. Even with all that, there continues to be a lot of vaccine hesitancy in our in our populations, and again, that is why I think forums like this are really helpful to understand why that might be and how we can continue to move the needle to get more patients vaccinated. We know that there are certain groups of patients that ultimately are less likely to get the vaccine than other groups. And those include younger patients are less likely to get the vaccine than older patients. Young females are less likely to get the vaccine than young males. Certain races are less likely to get the vaccine than other races. And so we can use all of that information to help inform our decisions. But what I think is really important is that we really have to have individual conversations with patients when it comes down to the COVID vaccine and how we educate and encourage and listen to the patients and figure out why they are hesitant to get the vaccine and how we can do that better. When we talk about the vaccine, I think it's also really important that we have a brief conversation about the history about how we got here. We know that some people say that this vaccine was rushed. It was too quick to market, and therefore I'm not going to take the vaccine because I don't trust the process. And it's important to state that these vaccines went through the same regulatory process of any vaccine that has come to market. Yes, it went fast because people were dying and we needed it to go fast, but ultimately all the steps were followed, all the phases of the clinical trials happened and went through. And the difficult part for us or for me specifically as an OB provider though, is that OB patients weren't included into those initial clinical trials. And so we were really waiting on the data to come about after patients were vaccinated, and we really leaned on a lot of the data that came out of the registries after patients were vaccinated. Specifically, one of the registries is called the V-Safe registry, and this registry really has collected a lot of information about patients once they get the vaccine, and then they've looked at pregnant people that were either pregnant when they got the vaccine or got the vaccine prior to pregnancy. They looked at over 3,900 pregnancies and over 800 completed pregnancies, and that data is helping to really inform our decision about the vaccine. We know now that the vaccine does not cause an increased chance of miscarriage, an increased chance of growth restriction, of stillbirth, of preterm delivery. And so that's really good information that we have and that we can talk to patients about. And so that's a nice place to start. We can delve into some of that specific data a little bit later as this talk goes on. But I was also asked to kind of just touch about the recommendations. So it is currently recommended by all the national societies, including ACOG and Society of Maternal Fetal Medicine, that people that are planning to conceive, that are pregnant, or that are lactating should be vaccinated for the COVID-19 vaccine. And currently we're recommending the mRNA vaccines for our populations. And so those vaccines are the Pfizer, the Moderna vaccines, and they would be 3 to 4 weeks for the initial series and a booster at 5 months. And if a patient was to have gotten the J&J vaccine, we're recommending a booster at 2 months for those patients.
All right, thank you very much. It was a tough challenge to give that summary in a short period of time, but you did a great job. Thank you. Perfect. So I'm going to go ahead and now move into the official Q&A part of tonight's event. I may direct questions at certain panelists. However, please feel free to weigh in on questions, even if I didn't specifically call you out. Each one of you is really bringing a great perspective, and I'm sure we'll be able to add on and build off of each other. So I really encourage you to do that. And so to get things started, Kris, I would love to start with you and learning more about some of the biggest barriers to accessing the vaccine in your community and what the health department has been doing to work with the community to help navigate those barriers.
Thank you. So I think for us, this is a very rural area, and our clinics are located and the hospitals are all located in the major community in each county. And not everyone has transportation to those sites. And so some of the things that we have done to try to assist with access to vaccine is to host clinics in each individual small community so that residents can come to someplace more local and not have to travel. Additionally, our agency purchased a mobile clinic van that will go out and actually vaccinate folks at their homes. It started as being used primarily for the senior population who were shut in, but it transitioned to, if you don't have transportation, give us a call, we'll come to you and give you a vaccine. I think the other part that's been challenging is a lot of that misinformation and disinformation that's been out there. Just trying to provide educational materials that folks can understand, and we try to encourage messaging through regular media channels, social media, and our website about what we do know, and being respectful that folks do have the right to choose. And that's where this divisiveness has come into the conversation, and it's very unfortunate. It used to be we could just agree to disagree, and that was the end of it. But as Najma has mentioned, we have families that have stopped speaking to each other over this issue, and it's very unfortunate. Every individual has the right to choose what to do with their own health, and I've made the choice to get vaccinated because of the climate that I work in healthcare. But I have 2 of my sons who are adamant they will never be vaccinated, and it's okay. And I tell them that it's okay. It's your body, it's your choice. But these are the reasons why you should really consider it. So I think, having open, honest conversations, and as Dr. Popp said, addressing concerns, not being judgmental, just, so what is your concern about the vaccine? And they might share it, and they may not, and that's okay.
Right, thank you, Kris. And actually, that really is the perfect transition for my next question. So Najma, one of the most common concerns about the vaccine is really not knowing or trusting what's in it. And so I'm curious to know, how do you respond or begin to address those concerns in the work that you do?
Okay, I had to make sure I was unmuted. Okay, I had been pondering on how to respond to this question. And for me personally, when I had this conversation with families, I validate their concerns. They're very valid. I am an African-American woman, And most of the families that I connect with are African-American people. So to downplay or try to say, well, this was this many years ago, or this only happened then, and it's not like that anymore, is even more discouraging. And, that's just not something I would do. It's not something I even recommend that someone would say, even in the field that some of the other panelists are in. These are very valid concerns. And I think to validate that and to let, the families know that you have every right to feel that way. And this is going to be a personal decision. It's not something no amount of information I can give to someone to try to force them to be vaccinated or not to be vaccinated. As Kris mentioned earlier, this is a choice. And that's what I want families to leave with. Here's the information that I have. And I trust that you care about your family enough to know what it is you want to do with that. That's how relationships should be able to stay strong and valid. Someone may choose to change their mind based upon that conversation versus feeling like, oh, well, you're just not educated. Let me just educate you. Let me educate you. Let me educate you. Like, I am educated. You told me the information, and now allow someone to go home and to digest that and be respectful of the choice that they made. And as Kris mentioned, it's because there's just so much division that comes with that. And that's, just one of the biggest concerns. So I let families know, it's a valid reason. You do have every right to be concerned, and moving forward, you then have to make that choice if this is something you want to trust or not trust, or if you want to wait a little bit longer, until you are comfortable with it. I don't try to assure families that this is what you should do, that, oh, I'm 100%. I can't give that validation. I don't even want to carry the burden of telling someone that I am 100% sure that their family is going to be fine. Because who am I? I don't know. I don't know what tomorrow is even holding. Okay. We thought that we were going for 2 weeks in March, way back then, to we're still here. Now we're Zooming everything. So I don't try to offer that, but I just try to, leave with that encouragement that I trust that you love your family enough to make the best decision after the information is given to you. Invalid information, not social media information, and most of the time I don't even bring that up because I don't want families to feel as if I am discrediting how they receive their information either. So we have to be very sensitive with that as well, because you don't want to make this assumption like, oh, don't trust everything social media says. Like, who told you I was looking at social media to get my information? Who told you I didn't sit? Families are sitting on their computers all day trying to research, trying to find information. And there's information out the bazooks, okay, everybody, like all over, that's going to validate or disvalidate. Like, you're going to find it on both ends, and so this is a really challenging time for families. So I'll be done there.
I think you did an incredible job, Najma. I want you in my clinic with me, helping talk through this with my patients. But I just wanted to jump on one of those things that you said. It's all about the relationship, right? I mean, a trusting relationship is not me walking into the room, I've never met you before, and spewing all my facts and then walking out of the room. Like, there's no trust there. It's all about me hearing the lived experience of the patient, understanding where they're coming from, trying to understand the best that I can where they're coming from, and then knowing that this is hopefully going to be a relationship that evolves over the course of the pregnancy if that's the first time that I'm meeting them, and having them, encourage them to come back with questions. What do you need to know from me? How can I help? How can I assist? And then we figure out where we get at the end of that. And obviously I would love for them to get vaccinated, but I that's their decision, and we're going to try to promote that in the most positive light as possible.
All right, thank you. Thank you both so much. And that is why I'm so glad to have both of you here tonight, to be able to share that information and, begin this conversation and dialogue with many folks who are here. So we have many questions related to breastfeeding. So Amanda, I am going to turn it over to you. And I'm wondering, first, if you could just provide some information about individuals who are getting vaccinated while breastfeeding. And then I have a more specific question that came from an attendee tonight asking or saying that she has breastfed since day one. She was vaccinated when her baby was 6 months old. And now that the baby is 1, and she will continue to breastfeed. Does she really need to vaccinate the child once it's approved for little ones, or is she already protected? So I'm happy to repeat that if you need, but I think it would be really helpful to maybe set the stage a little bit with information about breastfeeding and then dive into that specific question.
Yeah, thank you. So, I mean, breast milk has always been such a key factor for moms and babies when they're so little. And we actually, the first milk that moms receive is called colostrum. And in my clinic, we call it baby's first vaccine, because it's just full of all this good stuff for babies. And we try to explain to moms that a lot of babies are too little to have their their full set of vaccines. And so giving them that milk is just one little gift that you can give them. And so with, this, it's definitely no different. Your baby's going to receive the, antibodies from the vaccinated mother. And right now it is not approved for the younger than 5-year-olds. And so I do think that it is especially important to continue breastfeeding as long as possible so that your baby is continued to be protected. Now, to answer that question, from the research and knowledge that I have heard that the immunity does wane from the vaccine. And so I would say that getting your baby vaccinated would be important, just because you want to make sure that they're fully protected. You've given them such a great start. Kind of why not just continue?
All right, thank you, Amanda. And so please, I know breastfeeding is a very big point of concern and people have a lot of questions about it. So please, anyone in the audience, feel free to continue adding your breastfeeding questions. For now, I'd like to go back to Dr. Popp. I heard in your overview, you did mention that the data isn't showing any significant impact on birth outcomes such as miscarriage or preterm birth. So I was wondering if you could just reiterate and go over that point, since that is a very valid fear for many folks out there. And then also speaking to another concern about the vaccine's impact on fertility and what we know about the vaccine's impact there.
Yeah, absolutely. So we'll start with miscarriage. So first trimester loss obviously is something that's relatively prevalent in our society. Unfortunately, 1 in 4 women are going to experience that in their reproductive lifetime. And so it's something that we would never want to increase with any intervention that we did. The CDC did a study where they looked at 2,400 women that received the vaccine either conception or in the first 20 weeks of their pregnancy. And that was the study population looked at and compared it to controls. And they found that there was no increased risk of first trimester loss in those patient populations. So that was really good information that we had. There was another study that they looked at the timing of miscarriages after getting a vaccine. And so they looked at a 28-day window. So if you were vaccinated within 28 days, they looked to see if you had an increased kind of spike in having a miscarriage, a kind of causal to getting that vaccine. And again, patients did not have that increased risk. And so I think we feel comfortable with that data, and there's more coming, that at this point, we do not think that there is an increased chance of miscarriage. Now, if you are not pregnant and you're trying to conceive, what does the data say about fertility? And so again, the data that we have to this point, and just like Najma said earlier, I'm not going to sit here and say, I know that this is the 100% all the information. We're working on it right? We're getting more information, but the data that we have at this point actually shows that there's not any issues with conception with the vaccine. And so we're recommending vaccination. The biggest study that's out there is actually a study looking in the IVF literature at frozen embryo transfers. They took patients that ultimately had COVID, that were COVID vaccinated, or that were not vaccinated, did not have COVID. And they looked and compared all three of the groups through early implantation and early pregnancy. And they found that there was no differences in any of those patient populations. Again, reassurance that most likely fertility is not affected by either having COVID or specifically the COVID vaccine, which is really what this study was looking at. So again, reassuring data that we talk to patients about, and but more data to come, because this data is really starting to come out really quickly now as we've had more patients that basically have been vaccinated and we have more information to share.
Great. Thank you so much for being so clear and summarizing that data. I know personally I get very overwhelmed looking at it. So it's very nice to hear that clear synthesis of the information. And so next up, we have another question here for Kris in just asking, how can people who are pregnant or recently had a baby stay safe and protect themselves from COVID-19?
Well, I think the first thing is that we need to be sure we're following the practices that we know keep us safe. Vaccination is a safe and effective way to maintain mom and baby health, and having folks around the child that are vaccinated as well is a positive thing. I think we also need to make sure that women are having conversations with their primary care or their OBGYN and their pediatrician about what is the best strategy for them when it comes to vaccine. Limit exposure to large gatherings when the baby is small, and when you are, just recently postpartum, you need to take care of yourself. You need to focus on your health and doing all those things like social distancing and use the Walmart pickup grocery thing. I discovered that in the last 6 months, and it has been the most wonderful thing in the world that I don't have to walk through a grocery store anymore. Utilize those convenient services that are available to you. If you're in a bigger community, there's probably even more services that are available to you so that you don't necessarily need to take the baby out and expose the baby to the community. The government has been offering the free COVID tests through the US Postal Service. I encourage everyone to take advantage of that. If you have family that you want to do a gathering, encourage folks to test before you all get together. That's a positive thing to do. If you have someone that wants to visit the baby and they have cold-like symptoms of any type, encourage them not to come visit until after the baby, after they feel better. And because, folks have a difficult time. Is it COVID? Is it influenza? Is it just the common cold? Because the symptoms can be very similar or identical. So just if folks don't feel well, politely ask them, please don't visit until you feel better. Wash your hands a lot. You have a brand new baby, you're going to be changing diapers, you're going to be feeding that child. You should always wash your hands before and after using the bathroom, whether it's for yourself or the baby. You should always wash your hands with soap and water before and after you eat. Make good habits. And for those who, if you have other children in the household, it's a good time to get them in that same routine. Wash their hands every time they use the bathroom, wash their hands before they eat, wash their hands after they eat, wash their hands frequently. And get a hold of your primary care doctor at the first sign of illness in anybody in the family. Whether you're getting the sniffles or one of the children have the sniffles or the baby doesn't feel well, reach out to your primary care doctor and, ask the questions. Do I need to bring the baby in? What should I do? So I think those are probably the best safety measures that we can take at this point to try to keep everybody safe and healthy.
Great. Thank you, Kris. And related, Amanda, I have a question for you about how to safely breastfeed if the breastfeeding individual has been diagnosed with COVID.
Yeah, so that's a great question, and that's a common one right now. I know initially in the pandemic, it was something that we were very nervous about and very unsure about, and there was actually separation that was taking place with mom and baby, which was just so devastating for me and, you know, my coworkers who support lactation. It was just like very difficult, but you know, definitely as we did the best that we could at that time. So I'm glad now that there's been research to show that separation does not need to take place, and most of the time moms and babies are being kept together, even if the mom has been diagnosed with COVID. So again, you know, breast milk is going to be the best source of nutrition for your baby, and it provides, again, protection against, you know, so many illnesses, including COVID. And so it's important to not discontinue breastfeeding if you feel well enough to do so. Research has found that COVID-19 isn't transferred through the breast milk. However, the antibodies that protect your baby are. And so important things to do if you are diagnosed with COVID, you're washing your hands as much as possible, especially before touching the baby. You're using sanitizer with at least 60% alcohol. A lot of moms choose to wear a mask during that time. You know, just doing everything you can to protect your baby, and breastfeeding is just kind of one of those extra things that we can do. And again, you're giving your baby those antibodies, which is such a gift.
Okay, thank you, Amanda. And Dr. Popp, we have a question for you. Someone wrote that they've been made aware that getting COVID can increase their chance of blood clots in pregnancy. Is this true? And if so, how does the vaccine impact this?
Yeah, so definitely in pregnancy, we worry about your increased risk of blood clots if you're COVID-19 positive. And so how the vaccine basically impacts, so with the vaccine, there's no increased risk of getting blood clots. And so ultimately we want to get you vaccinated so prevent that risk. As far as if you were to have COVID-19 in pregnancy, what we do with our patients is as soon as that diagnosis is made, one intervention we do is we start the patient on baby aspirin throughout their pregnancy and educate them on signs and symptoms of DVT and PE. So then we can get early evaluation if they are to have those symptoms. That includes everything up to a kind of a home pulse ox monitor. So that is a concern for us. We also will put you on blood thinners if you're hospitalized with COVID-19 in order to prevent that from happening as well.
Great, thank you for that information. So Najma, I'm really curious, when you are doing your community engagement work, what advice or recommendations do you give to families so they can make the right choices and making sure that their family stays safe?
Okay, so advice to my family. So again, transparency is going to have to take place. So this is when you're going to have to put on like your big girl undies and set your expectations. As Kris mentioned earlier, with like new baby or being pregnant, first of all, it was a no-go before COVID. It's really a no-go now. Like, there's no need for visitations. Whatever you do it on the porch, leave me some food on the porch, have a good day. But you have to set those expectations. You have to let people know where you stand. You know, whether it be that you're vaccinated or not vaccinated. If you are vaccinated and people still have concerns. I have family members that are vaccinated, they still stay masked up and they still social distance and things to that nature. So you have to set those expectations with your families and your friends and let them know, hey, have you been out somewhere? Have you been going to places and things like that? If you have, I prefer you don't come to visit me right now until it's clear that you are not, I don't want to say contaminated, but that you don't have, the virus, utilizing the testing. There's a lot of at-home testing kits, that's being provided. Utilize that before you attend an event with family or before someone comes to your home. You can utilize that, of course, has been mentioned. And as my, he's 7, but as he would say, he thinks all of this happened because no one listened to their mom and washed their hands. For him, that's his understanding of COVID. If people would have just washed their hands, it wouldn't have ruined his birthday back in March of 2020. So he's big on just making sure everybody wash their hands. He's like, why didn't they just wash their hands? Like, if they would have washed their hands, this could have all been eliminated. But being open and honest with people with the visits, keeping your distance. If you are concerned about catching a virus and things like that, try to limit your exposure as much as possible. Unfortunately, those who have, kids that's going back and forth to school, immediately when they're getting home, washing their hands or in the car, like, hey, get some sanitizer, try to wash before you leave school, wash when you get into the car, wash when you get home, which was stuff we should have all been doing anyway. But I don't know, for some reason, it sounds like moms, guys, if they would have listened to us a long time ago, we would be good right now. But making sure, and like I said, if they're asking me for my recommendations and they're asking me for my advice, when you ask for my advice, that's what I'm giving. This is what you need to do. If you are fearful, of catching something, you need to just let people know, I'm not trying to hang out right now. I don't really want to be at your house, or I don't want you at my home, or we can visit in more of an open space. I have family members that are vaccinated, and I have like an elderly grandmother. I will not visit her until we are all tested and we have all quarantined at home before our visit. It's not a request that she's made. It's my grandma. I love her, and I want to make sure that we're straight before we enter into her environment. And so these are now those uncomfortable conversations that families are going to have. And you won't be able to be nervous. And so I'm always just trying to encourage people to find their voice in our community. You have to be able to have a voice, or I'm just going to be your voice. I'll call your family. You want me to call and tell them? I'll tell them, hey, she or he, this is just not a good time for them, or she just had a baby. Unless you're bringing dinner and you're sitting it on a porch, we really don't want you to come over and, hold the baby, or even come and hug me, because whatever you have, it can transfer, and things like that. So there we go.
All right. Thank you. Your son sounds adorable too. I just love that story. So, Kris, I have a question for you. So the CDC is now recommending that everyone 5 and up get vaccinated. Can you talk more about this new recommendation and the impacts on the health of the family, and potentially what role older siblings could play in protecting their families?
Sure. So the vaccine recommendation for 5 and up, the 5 to 11-year-olds receive a vaccine that is a third of the dose of the adult vaccine. It's only Pfizer at this time. And I think in part, it really does, the vaccine is really to try to help to get kids to be in a safe environment in a school population. As Najma mentioned, or Amanda mentioned, a school is a petri dish. Whatever kid sneezes, the entire class is going to be sneezing in 5 days. So I think that part of the recommendation comes from, in order to get children back in the classroom, we've developed a vaccine that we feel can be effective and safe in that population, that will allow the children to get back into the school and try to get back to some type of normal lifestyle. Also, if you have children that are between the ages of 5 and 18 who are vaccinated in a household with a child who's under the age of 5, that child's vaccination is providing some protection to the child who's unvaccinated. Again, teaching kids about hand washing and what to do, and to make sure they're talking and telling their parents or a trusted adult if they don't feel well. I think sometimes our kids are like, oh, well, the big football game is on Friday night and I got the sniffles, but I'm not going to say anything because then coach won't let me play, or mom will make me stay home, or, something of that nature. So, COVID has had an unfortunate large consequence on our kids. It really has, from a social, emotional, physical perspective. COVID has really struck all of our children immensely. You know, and even though kids typically get a mild case of COVID, I think one of the things that we're starting to learn a lot more about COVID is the long-term effects of COVID. As an example, I had a grandson who had a very mild case of COVID. 2 months later, he had a blood sugar of 418. Mom took him to an endocrinologist at University of Michigan, and the doctor said he had COVID, didn't he? She said, yep. We're starting to see long-term health effects. My grandson will now be a diabetic for the rest of his life, having to shoot insulin 4 times a day. So there are long-term health consequences to COVID. This is not your typical cold. It is not your typical influenza. COVID is having long-term health effects. And I talk to people, a lot of people of all ages who have had COVID, who said, you know, it's taking me weeks, it's taken me months just to feel better. And for some of them, they've developed health consequences that were underlying that just had the opportunity to explode once they had COVID. So, you know, vaccination is a way to protect ourselves. It's a way to protect our families, protect our communities. And my husband and his friend had a conversation one day. He says, do you remember when we were in school? And mind you, my husband's in his early 60s. He said, they line us up and they just shoot us in the arm with a gun. What happened to those days? I said, well, those days aren't here anymore. But, you know, it's true. Back in the 60s and 70s, vaccination wasn't a question. Kids were lined up and you were vaccinated. I'm glad we don't do that anymore. I think that we need to pay attention to the autonomy that every family should be able to make a decision for themselves and for their child. But, you know, it can be scary for parents to choose to vaccinate a child. And I think that there will be lots of questions if and when the FDA approves and the CDC approve a 6-month and older vaccine. But I think, as Dr. Popp has said, we need to follow the science. And right now the science is showing that vaccination and getting your immunity to COVID through vaccination is much less harsh on the system than to have COVID and try to recover from COVID and have immunity in that way.
Thank you, Kris, and thank you for sharing your own personal story. I really appreciate that. So we're getting towards near the end of our time together, and there's still 2 points that I really want to make sure we cover. And so first of all, we haven't really touched on boosters yet in this conversation. And so Dr. Popp, will you be able to give a quick overview of what the recommendation is about when to receive the booster shot? And then in addition, we have a question about people hearing rumors about a second booster or 4th shot and what we should expect with that.
Absolutely. So as far as the current recommendations for booster vaccines, we recommend that after you've received the mRNA vaccines, the Pfizer and Moderna series, that 5 months after that, you should be boosted. And so this is for, we're kind of specifically talking about the OB population, right? The OB pregnant population. If you're severely immunocompromised, that window narrows a little bit. So just to be clear. And then if you were to have gotten the J&J vaccine, that boosting time is 2 months after you got the J&J vaccine, and they're recommending that you get boosted with the mRNA vaccine, either Pfizer or Moderna. And so that big recommendation against the J&J vaccine at this point is because of the side effect of patients getting a blood clot and low platelet syndrome that is happening with that vaccine, especially in the younger female population. And so that's the recommendation for boosting. And I will just say that it's really important that we continue to push beyond just getting the initial primary vaccine series, and we go through boosting as well. Because if we have maximally vaccinated patients, we know that they are not getting as sick with COVID. There was just one stat that I had that I just thought was so dramatic. I feel like we should share it. And again, this isn't specifically with the OB population, but if you're maximally vaccinated, you've had your vaccine and you've been boosted, and you're comparing yourself to the unvaccinated population. So the unvaccinated population compared to the maximally vaccinated population have a 13 times increased risk of getting COVID. But the stat that's really devastating, I think, is they have a 68-time increased risk of dying. And so this is a big deal. And again, if people have already gotten the primary series, I feel in my personal practice, it is a little bit easier to have the conversation about getting the boost done. And a lot of it is sometimes just pointing it out to the patient that they're due for it, because we forget, right? Our lives are busy. We have many kids. We have a lot of responsibilities, and you forget that you're due for that booster. So making sure that that gets done. Now, as far as having those booster vaccines, like the third and the fourth booster and kind of going down the road, I feel like that's evolving, and I don't feel as if I have that science very well in my head. So I'm not going to say something that is not correct. But I do think that they're continuing to look at this, and I think that there probably will be, over time, maybe an annual COVID vaccine that we're offered in order to try to keep all of us safe. But I think time will tell with that.
Great, thank you so much. And so we are right on the dot. It is 7:30. I wish we could keep going, but really, just thank you all. Thank you each of our panelists so much for being here and offering your insight. I really have learned so much tonight, and I hope that the attendees also have. And so just as a FYI, this panel is being recorded, and we are going to make it publicly available to share, so that way all of your fabulous messages will continue to spread throughout the Region 9 communities. And then if there's any remaining questions, please feel free to send them our way, and we will do our best to update the Region 9 website with the most up-to-date resources and recommendations, so that way you have all of the tools at your fingertip to make the decision that's best for you and that's best for your family. So thank you all so much once again, and I hope everyone takes care and stay safe and enjoy the rest of your evenings.
Thank you. Thank you so much.